Sometimes you feel a mass in the middle part of the neck, and they stick the tongue out and it moves.
Sure.
What is that called?
There is an entity called the Thyroglossal Cyst, and that's a mass found in children in the pediatric population. And what it's caused by is in embryologic development, when the body is forming, the thyroid gland, which sits here low in the neck, is actually in embryologic stages at the back of the tongue. And over time, that thyroid gland descends from the back of the tongue into its native position in the neck. The track, or the pathway that it takes to go down the neck, oftentimes will have a slight anatomical remnant that's there, something that's still left. And that can form a cyst. If that happens, you can have a protrusion in the center part of the neck, or you can have a lump in the center of the neck that you'll see.
And how's that fixed?
Thyroglossal cysts are removed surgically. One of the important things to determine is whether or not the child has their native thyroid gland, and is the thyroid gland still in place and functional prior to doing that. Back a long time ago, many years ago, the cyst was just removed on its own, and that's all that they did. They had a very high recurrence rate. About 50% of the time the cyst would recur. In recent ages, we've developed a technique called the cyst trunk procedure, and that is where you move the cyst itself, the Thyroglossal cyst, and a small portion of the hyoid bone, which is a bone that sits here in the neck. And that's decreased the recurrence rate from 50% down to about 2%.
So we're getting better at what we do.
We are.